For over a century, the American Academy of Pediatrics, the supposed champions of children's health, have positioned themselves as infallible guardians. But history tells a different story. A story of institutional blindness, corporate coziness, and catastrophic delays that have scarred generations of American kids. Today, we rip off the mask and expose the AAP's most egregious failures. These aren't minor oversights. They're betrayals that have fueled epidemics of disease, disability, and despair. Let's dive into the damning evidence. From the 1940s to the 1970s, the AAP didn't just sit idly by. They actively endorsed infant formula as equivalent or even superior to breastfeeding. They greenlit aggressive marketing campaigns by formula giants, reassuring doctors while failing to champion nature's perfect food. The result? Breastfeeding rates cratered from 70% in the 1930s to a pathetic 20% by the 1970s. Infants suffered skyrocketing infections, allergies, and obesity risks. Mothers faced higher breast cancer odds and slower recoveries. This wasn't science, it was surrender to industry profits. Historians call it one of the biggest pediatric blunders in U.S. history, a generational gut punch that still echoes in our obesity crisis today. Failure number 2, turning a blind eye to lead's silent assault. The AAP dragged their feet on lead exposure, underestimating risks and peddling myths of acceptable levels long after environmental scientists sounded the alarm. They reassured the public while millions of children, especially in poor communities, inhaled and ingested this neurotoxin. The toll, irreversible cognitive damage, behavioral disorders, and generational harm that historians now agree was entirely preventable. How many dreams were dimmed, futures stolen, because the AAP prioritized complacency over courage? Failure number 3, letting tobacco clouds choke our kids. Until the 1980s, the AAP downplayed the horrors of secondhand smoke, refusing to aggressively advocate for smoke-free homes and swallowing tobacco industry propaganda. They underplayed risks while childhood asthma, ear infections, SIDS, and respiratory diseases surged. Nationwide policies lagged, costing lives. Only decades later did they pivot. Too little, too late. This wasn't oversight. It was complicity in a smoky slaughter. Failure. Number 4, building an empire on a faulty pyramid. In the 1990s and 2000s, the AAP uncritically championed the USDA's food pyramid, pushing low-fat, high-carb diets, sugary cereals, fruit juices, and refined grains as healthy. They normalized ultra-processed sludge in schools, abandoning healthy fats and proteins. The fallout? An explosion in childhood obesity and type 2 diabetes, epidemics that nutrition experts now label a monumental policy disaster. The AAP didn't guide, they misguided, fattening a nation for corporate gain. Failure. Number 5, dismissing the digital drug. For over a decade, the AAP minimized early screen exposure, fixating on educational content while ignoring threats to mental health, attention, and sleep. As smartphones and tablets exploded, families got no real guidance. Now, earlier addictions, rampant anxiety, attention deficits, and sleep chaos. They've reversed course, but the damage is done. A wired generation wired for breakdown. Failure number 6, ignoring the mental meltdown. For years, the AAP treated pediatric mental health as an afterthought, failing to demand reforms, underestimating depression and anxiety spikes, and ignoring social media's poison. Suicide became the second leading killer of teens. Psychiatrist shortages ballooned, ERs overflowed. They now call it a national emergency. But where was the urgency when it mattered? This neglect isn't just failure, it's abandonment. Failure number 7, pills before prevention, the pharma puppet show. The AAP's chronic habit, quick to endorse ADHD stimulants, SSRIs, and more, while downplaying lifestyle fixes and accepting drug company research. Root causes like poor sleep, stress, junk food, inactivity, and pollution ignored. Now youth polypharmacy soars, trust erodes, and symptoms are masked while sickness festers. This over-medicalization isn't care, it's corruption. The AAP's Hall of Shame. Formula favoritism, fueling generational woes. Lead lethargy, causing brain rot. Smoke denial, suffocating innocence. Pyramid propaganda, birthing obesity bombs. Screen softness, shattering minds. Mental health myopia, unleashing emergencies. And drug dependency, dodging real cures. These blind spots aren't accidents, they're institutional rot that demands accountability. Parents demand better. History's lessons scream, when guardians fail, our children pay the price. Question authority, protect the future.